Good afternoon, everyone. Andy Jacob here with the DotCom Magazine Entrepreneur Spotlight Series. We have a very, very special show today. I've been waiting to get our guest on for a number of weeks. We've finally been able to book him in. You probably know about him if you watch TV, if you're on social at all. He's everywhere where he needs to be to talk about plastic surgery. He is a board-certified plastic surgeon. He is a member of the American Society for Aesthetic Plastic Surgeons and Surgery. He is one of the leaders in the field. And I'm not just talking about an American leader. He is a worldwide leader in plastic surgery, talking about plastic surgery, talking about the importance of selecting a board-certified physician. He is a leader in the field. His name is Dr. Adam Rubinstein. You've probably seen him on TV, and now he is on the DotCom Magazine Entrepreneur Spotlight Series. Dr. Rubinstein, welcome to the show.
It's my pleasure to be here. Thanks a lot for having me.
Well, I love it, Dr. Rubinstein, and I know you just got out of surgery just a few minutes ago, and thank you so much for slicing some time out. Dr. Rubinstein, in the world today, and let's just focus in on America just for a minute, there's a lot of surgery going on that probably are not being done by board-certified surgeons and people that really have the expertise to take great care of their clients. Maybe you could just talk on that a little bit and tell us why that's so important in not only the world of plastic surgery, but in your world as a leader in talking about how important that is.
Well, people sometimes take this too lightly. And again, thanks for having me on. This is all important stuff. And I'm glad we get the chance to talk about it because you can't talk about this enough. And getting that message out there may really help someone and potentially save a really bad situation, maybe save someone's life. So when you're thinking about having plastic surgery, you really ought to be looking for someone who's properly trained. If you needed a cardiac bypass, you wouldn't go looking for the cheapest deal or anybody that could do it. You'd be looking for a qualified cardiac surgeon. For some reason, when it comes to plastic surgery, people get the idea that, well, it's just plastic surgery, just cosmetic surgery, and doesn't matter who's going to do it. And people go looking for a bargain, and that's a recipe for disaster. So, you should start with doctors that are certified by the American Board of Plastic Surgery. There's only one board in the United States that certifies plastic surgeons, and that's the American Board of Plastic Surgery. Sometimes people will claim that they're board certified in cosmetic surgery. Well, there is no American Board of Medical Specialties board in cosmetic surgery. So when you hear that, it's not really the kind of board that people should be looking for. There's only so many real boards. And you go to your internist, the American Board of Internal Medicine. You go to a pediatrician, the American Board of Pediatrics. In plastic surgery, there's only one. It's the American Board of Plastic Surgery. So that's where you should start. And the reason you should start there is because that guarantees that your doctor is properly trained. And that means that doctor has done prerequisite general surgery or other training in just surgery in general, and then graduates into or proceeds into training in plastic surgery. And that is a minimum of 3 extra years of training after many years of surgical training. And in many cases, like in my case, I went on and I did other fellowships besides my plastic surgery training. So you can have lots of training in many different branches of plastic surgery and be well qualified. But at a minimum, in order to be board certified, you have to complete that prerequisite training. And then you have to do these exams. You have to do a written exam. And if you pass the written exam, which some people don't many times, then you have to do an oral exam. And some people don't pass the oral exam. These are given almost a year apart. So you have to show that you've done a lot of cases, submit your cases. I mean, we could talk about it for a while. It's a big, long process. Suffice to say that if you're seeing a board-certified plastic surgeon, the American Board of Plastic Surgery, that person has the proper training and he or she is going to keep you safe.
That's fantastic. And that's the most important thing. This is very serious business. And, you hear the stories, Dr. Rubinstein, about, someone that's not certified and maybe, they focus on the feet, but now they're doing plastic surgery, or they're a doctor that maybe is a family doctor, but all of a sudden they start doing plastic surgery without the board certification that you mentioned. And you've become very, very well known worldwide as someone that uses a lot of humor to get across this idea of how important selecting the proper plastic surgeon is for this very important and serious procedure. And we're going to get into that in a minute, but let's talk a little bit about why this has become your passion, Dr. Rubinstein, because when people think about the physician in the world that really is really the outspoken proponent of getting great plastic surgery from a certified, board certified, American Board of Plastic Surgery certified physician, you're top of name. Your name comes up there. So why has this become so important to you?
Well, it's important to me because I want everyone that has plastic surgery to have a good experience. And I have seen more than my fair share, and I keep seeing it, of people that had a rough go. And more often than not, it's someone that really unwittingly ended up in an office where they thought they were seeing a plastic surgeon and they weren't. You really have to be careful in the questions you ask and how you look people up. And it's difficult. The public just doesn't know. I feel like as a plastic surgeon, someone who's very involved in organized plastic surgery, just as someone who loves what I do, and I want everyone to have a good experience when they seek having care from someone like me, I feel like we owe the public a debt to, we have a responsibility to the public to really educate them and help them educate themselves. And it's not easy. So it's actually quite easy to end up in the wrong situation. So that being said, we have to be the shepherds. We have to be the ones that can say, listen, here's what you look for. This is where you can find it. And that's what's going to keep you safe. And I'm happy to say my professional societies, the American Society for Aesthetic Plastic Surgery, the Aesthetic Society, the American Society for Plastic Surgeons, are very dedicated to getting that message out there. But these are relatively small organizations that, we can't do it without shows like yours and helping us spread the word. That, to me, it's so important just to know that my profession is providing the right type of care. People are having good experiences, getting great results. And that's what it's about. I do this because I want people to feel better about themselves, want to help them get comfortable in their own skin, no pun intended. And, it doesn't work out that way for everybody. And some of that is preventable. So I think if everyone's educated, then we'll have less of these disasters. And, I feel like it's part of my job, part of my responsibility as a plastic surgeon to help people, no matter where they're going to go. And I'm not talking about just people that come to see me. Hopefully, I've been able to counsel and help and educate thousands and thousands of people through social media and other appearances. I hope that information has helped people know what to look for, know where to look. And, I'm continually working on ways to expand that and help it. To me, it's very important that I do what I can, not only to help my own patients, but to help just the patients in general be able to navigate this road, because it's not always easy.
Yeah, I hear what you're saying, Dr. Rubinstein. And obviously, you're known as a physician with compassion and modesty and kindness. And there's also another side of you on social media that's trying to get the word out in a way that's meaningful to people that's watching it. And we're going to talk about that momentarily. But let's talk about your practice, because I know that it's very hard to get in to see you. I know you have so many people that want to come see, you for their plastic surgery and the various procedures that you offer. But what about the people that made the bad decision, that perhaps went to someone and their job just did not go as well as what they expected? Maybe they picked the wrong physician, maybe they weren't board certified, maybe it just did not work out as well as they would have liked. Do you have that part of your practice as well, where you see these people that sort of had a job that was, I guess, call it botched, and then they come to you to sort of clean up the work and fix it up for them?
Absolutely. And as I mentioned earlier, I see, in my opinion, I see way too many of these. And there's too many cases that probably shouldn't have happened, but did. And just unfortunate outcomes. Sometimes, look, bad things happen in the best of hands. My patients will have a complication every now and then. In the world's best surgeon's hands, patients will have complications. But when you put yourself in a good situation, you're diminishing those chances. You're giving yourself the best chance to have a great result. But if you put yourself in less than desirable circumstances, there's a good chance you're going to end up coming to see somebody else later. And in my practice, I see, unfortunately, a lot of that. And I'm happy to help people. I'm happy to try and do these corrective procedures, and we do them quite often. And it's a challenge. I enjoy the challenge. I talk about this a lot in different outlets, and I should really charge more for doing these kind of revision procedures, because they're harder. They're technically more difficult. There's more to think about. It's a more difficult operation. But as I mentioned before, I want everyone to have a positive experience. And when I see someone that had a lousy experience, it bothers me. So I end up discounting my fees to try and help someone who's already come out of pocket, already had a procedure, and now they're in a tough spot. So just out of empathy, I end up trying to give people a break, and I probably should work harder. As a matter of fact, in terms of giving people a break, I see, people will send me through social media or email, they'll send me their stories about what happened. I have a program that, not on any regular interval, but periodically, when I see a case that's just a real tearjerker, just wrenching your heart, my program's called Turn the Page, and I will choose every now and then a case and offer to correct it at no charge to the patient.
That's unbelievable. And that's part of this compassion that I was talking about that you're known for, as well as your modest approach to what you do, and of course, how kind you are. And on the other hand, of course, however, you want to make sure that people make the right decision. So sometimes, there's a few ways to do that. One way is you can talk about it on a show like this, or you've been on Inside Edition and a lot of other, national and international shows. But you have this very unique and interesting way to get your point across on social media. And Adam, Dr. Rubinstein, I'd love for you to talk about that a little bit. Because I just, happened to watch one of your social media videos where you're actually on the video, called Mail Order Plastic Surgery, I think was the name of it. It was just very funny, very poignant. But what it really does is it got me to watch it, and then it got me to think about it a little bit. And if I'm thinking about it, I know so many other people are thinking about it. They're reaching out to you on your social media platforms, and they're asking you, hey, Dr. Rubinstein, what do you think of this? What do you think of that? What's your recommendation? What's your suggestion? Or, you've really impacted me. I was going to go to this physician that wasn't board certified. Now I've changed my mind, and I'm going to one that is board certified, let's say in California or New York or Maine or Washington, wherever you are impacting people. So how did you come up with this idea to get across on your social media platforms this important information with such sort of a unique, funny video opportunity that you've been able to put in so successfully on social media?
Well, the message is always the same. And, I've talked about it so many times, in so many different places, that you have to wonder, well, how can I make this fresh? How can I make people listen to it and pay attention? I mean, frankly, it's kind of a boring story to listen to unless you're looking to get something done, and then you get educated. But I wanted to freshen it up and find a way that's relatable. And more than that, you hear these stories of crazy things. And for the longest time, I've been talking about this and trying, with a serious tone, trying to say, look, this is what you look for. Here are the things you need to be thinking about if you're going to have a procedure done or choosing a doctor. And that will go so far. But some of the stuff I see is just ridiculous. And I take it as motivation and inspiration, really. For example, what you're talking about is a hashtag campaign that we're doing called hashtag It's Not All the Same. And I started that because everyone seems to think that getting cosmetic surgery is no big deal. It's like buying a sweater. You can get a sweater at Marshall's, or you can get a sweater at Saks. And if it looks more or less the same, it's the same kind of sweater. So, why pay at Saks for what you can get at Marshall's much cheaper? Plastic surgery is not something you're going to get in a bargain bin. It's certainly not something you should try to get in a bargain bin. And people look at it that way. And that's why you end up seeing people that go to see pediatricians and gynecologists to get their liposuction done. Oh, well, it's just liposuction. So I started this, I want to get the message there that it's not all the same. And that's what the hashtag is. And we've done a number of videos. I'm trying to think what the first one we did was. One of the things that inspired me, there's a doctor out there who's very famous, world known because of social media, and he was offering drive-through Botox in the height of the pandemic. Okay, seems like, well, how else are you going to do it? They can't come to the office. But now how ridiculous is it that they get in line in a car, they pull up, leans in the window, pop, 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 while leaning in the window, steps out, you drive on your way, and you've had your Botox. It's not really a great way to be delivering medical care, but people were into it. And I saw this on news outlets that he was doing this. Not always met with the greatest reviews, but it was still controversial and it was a news story and people were seeing it. And I've heard too many people say, oh yeah, I think I'm going to try that. What? You're going to sit in your car and have someone lean in the window? Okay, well, if you're willing to do that, I got an idea. Why stop at Botox? So, of course, it's satire, but we made this whole video about drive-through Botox, all in response to drive-through plastic surgery. We're not stopping with Botox. We're doing surgery. Well, come on through. We'll do drive-through plastic surgery. So, you've seen that video, and I think it's funny, but it's a way to, with some humor, get the message across. There's no way anybody watching that video is going to take it seriously, and we make such fun of the idea that I think it drives home the point that it's really not a good idea. Drive-through Botox wasn't a good idea, and drive-through plastic surgery is even a worse idea. So it's a way of getting that message out there in a funny way that's relatable, and you're not going to get bored watching the video.
Yeah, it makes all the sense in the world. Hashtag, it's not all the same. Dr. Rubinstein, you've got the Turn the Page program, which is remarkable. You're helping some people in that regard as well, helping to change their lives by fixing and changing some surgeries that they've had that did not go well. And that's really, really a beautiful thing. Now, when we think about what you do in the office, I would imagine there's been a number of changes through even technology over the past 10, 20 years when it comes to plastic surgery. So how does someone like you, who's so busy, you're on so many talk shows, you're an advocate for what you do, plus you've got a burgeoning practice in Miami where not only are people coming from the local area, but flying in from all over the world to not only, have you work on them, but also fix some of the challenges that they have had from other physicians. How do you stay on top of the newest technology? How does someone like you, who's so busy, stay on top of the newest procedures? That must be very challenging.
Well, a couple of things there. Besides the technology is actually easy. In my industry, I'm one of the guys that's known as kind of a tech guy. I'm one of the guys that hears about technology early, that pays attention to what's on the horizon. Companies sometimes will come to me and ask me, "Oh, check this out, see what you think." So I'm one of the early adopters of new technology, and we've got lots of the latest and greatest doodads here in the office, all kinds of machines, lights, lasers, because I think it helps us do what we do in a better way in many cases. So we try and look at all technology, and I'll take a look at anything, and if it makes sense to me, then we'll give it a whirl and see how it goes. And it's really helped me help my patients better because I've got a bigger palette to reach to when I have problems that I've got to try and fix, or patients to try and help them. Now, when it comes to keeping your eye on the horizon for plastic surgery news, well, that's a little different, and that's actually pretty easy. Anything you want to know, you can set up Google alerts. Every morning, I have Google alerts for plastic surgery, cosmetic surgery, plastic surgery investigation, cosmetic surgery investigation, plastic surgery death, etc. So I set up all these alerts, and every morning in my email, I've got an email that gives me the top, half dozen links to the stories that light up that alert. Anything that gets published across the internet, I see it. And, that's my morning paper. I skim that, take a look and see, what happened, what's been going on. And it helps keep me really up to date with reporting on anything in my field. And that's been important just to get a sense of not only new technology, but these problems that people have throughout the world, in this country particularly, and really stay abreast.
I love it. And you are absolutely a leading resource yourself. Now, what's going on in your field with regard to men? Because it seems like men are adopting the plastic surgery procedures more and more every day. So how has that changed your industry? And maybe you could talk about that a little bit.
Sure. That's definitely a trend that I've seen over the last few years, and getting increasingly each year. In my practice, I see a lot more than the average practice. I'd say 20 to 25% of my patients are male patients, which is probably double what the average is. The average, I think, is about 10%. So we see more than the average practice with men, and I think that number is going to keep increasing for everybody. The reason is, just in general, plastic surgery procedures are becoming more mainstream. People in general just feel more comfortable with them. You see and hear about them more, and there isn't that taboo. It's also more accessible. It's not as crazy expensive, and it's not just the most wealthy people in Beverly Hills reaching out to the plastic surgeon in secret. Now it's everybody. Everybody is having a little procedure done. I mean, Botox made it something for everyone. So people know about it, and it's not that expensive to have this stuff done. And, men care about what we look like too. So it's not something that's just for women. As we age, men get their little 11s and, the crow's feet. And to a certain extent, there is a double standard, and men can deal with more lines in their face, but we don't want to. So, we want to age as nicely as everybody else. And we're seeing a lot more men feeling comfortable coming to the office, talking about procedures. There's a different palette of procedures that men might want to talk about than the average woman, but there's a lot of similarity and crossover just in general aging. So as it's become more popular, it's become more accessible, and men feel more comfortable broaching the subject, having that conversation, and more men do.
That's incredible. And obviously, when people come into your office, you're all about healing. I mean, that's really what you're all about. Besides doing the procedure, you want them to heal afterward in the most powerful and fast way. You're known for that sort of healing experience. Dr. Rubinstein, let's talk about that a little bit. After the procedure is done, it would seem to me that the work just kind of gets started, because you have such a wonderful approach to healing after the procedure. Maybe you could talk about that as well.
Well, thank you. I practice what I consider holistic plastic surgery, and that's something that I've done from the inception of my career almost 20 years ago. Just having kind of a broad gestalt sense of the process, and not just being a technician, but really being a doctor and helping people through the process and really caring for them from the moment they walk in for consultation until that day they walk out from their last follow-up. And I try and bring everything into the process that I think is going to be helpful. So I've always used healing supplements, things like Arnica montana and bromelain. These are things that help decrease bruising and swelling. We give that to my patients as part of their surgical package. One of the trendiest things now is, especially with liposuction, is lymphatic massage. And that's also been a little bit controversial, to be honest. Sometimes what you see is lymphatic massage is nothing related to lymphatic massage. But I think lymphatic massage is a very useful tool, and we provide that to our patients too as part of our surgical package. In fact, speaking of tech, we use a very high-tech type of lymphatic massage that uses electric current conducted through the hands of the therapist with very soft touch into the areas of surgery that help pump the lymphatics and try and drain the excess fluid, the edema fluid out. So anything that I see like that, that's called a HIVAMAT, by the way. We use the HIVAMAT, we use our supplements, and lots of other things, various types of dressings at different times to try and help the wounds heal better. Anything that I can find that I think is going to help the process, we include, because again, I want my patients to have the best experience, and supporting them afterwards is even more important than actually doing the operation. I always tell my patients, I do the easy part, they have the hard job. They've got to make everything heal. My job's easy.
I love it. And, when I hear a physician like you, a world-class physician with the type of reputation that you have, talk about this unique, all-inclusive, holistic approach, I love it, because that's really what separates, physicians that are at the height of their careers versus some others that really don't understand that. And you're coming across in such an amazing way. You've got the Turn the Page program, you've got your hashtag It's Not All the Same. I invite people to hashtag social and go watch Dr. Rubinstein in his very unique and interesting way, in which he makes a great point about the other types of plastic surgeons that may not be the best fit for your procedures. And, when I think about leaders, worldwide leaders, and we've been very blessed here on the Entrepreneur Spotlight Series to interview many of them, something that comes up, Dr. Rubinstein, is what's your why? When we think of you and we think of someone at your height of your success, people might be asking themselves, Dr. Rubinstein, like, what is his why? Why does he get up in the morning? What motivates him? What gets him moving? Why does he get up early and read all the news and then read all the technology news? And then how does he have time for the videos that he puts up on the social? And how does he have time to be on the shows? And he's on nationwide TV. And then you have your practice. What's your why? Why do you get up in the morning?
There's a old adage that says, if you love your job, you'll never work a day in your life. And I love what I do. I'm not really working at this. I mean, my why is that I'm fulfilled every day when I come to the office, and I know that maybe we'll see a patient for their first follow-up. It's maybe the first time after surgery that they're seeing their results, that they've been in a dressing. And those are special moments. That's what I really love about what I do, is sharing that journey that patients are making. Frequently, they've been very self-conscious about something, about their appearance, maybe their whole life. It could be someone that was always very heavy, lost some weight, and then they lose the weight and now they've got to deal with skin, or it could be someone that, doesn't like their nose and has always been self-conscious about it and wanted to make an improvement, just never could afford it or never had the opportunity. But those moments when we're after surgery, seeing them for the first time, when they might be seeing the results for the first time, that's really special. That, they get a look at themselves, they look in a mirror, and maybe for the first time in their life, they feel a relief, they feel a comfort in their own appearance, in their own being. And that is I can't explain to you how powerful that is. It's a tremendous thing to share with my patients. And it's incredibly rewarding to know that I had some role in that. So, that's why I do what I do. If you look behind me, I've got various trinkets, and many of them are from patients that express that to me, just sharing their moment with me. And that is why I do what I do. That's my why, to having that intimate, incredible, touching moment with so many people.
That's wonderful. And I only really have one more question, and I know I've kept you over time already. I know you're super busy, and I want to thank you. Before I ask my final question, I want to say something here, Dr. Rubinstein, because I know that you wouldn't say it yourself, but I wrote down a few things prior to the interview getting ready. American Board, certification from the American Board of Plastic Surgery, American Society of Plastic Surgeons. You're an American Board of Plastic Surgery certification holder, American Society of Bariatric Plastic Surgeons, the Aesthetic Society, a top doc of 2021. And I know you wouldn't say that because, I'm saying it because you're more humble than I am talking to you about what you do and how much you really help the entire sort of ecosystem of this medical field. Now, let me ask you a final question, because I've been thinking about it, because as I was researching you, Dr. Rubinstein, it occurred to me that, this gentleman must have had a very interesting upbringing. And, we talk about it on the Entrepreneur Spotlight series about people that get raised with the can't do attitude, or they get raised with a can do attitude. And I would imagine, based on everything that you do and the way that you pack a full day of life into your day, that you probably were raised with a can-do attitude. You were probably raised with that type of attitude where, someone patted you on the back and said, hey, Adam, maybe they called you as a child, you can do this. So was that a defining sort of thought process as you were growing up, that you said to yourself, I can do this, I can do whatever I want to do, and then you made it happen? How did it all work out for you?
I think you're really hitting the nail on the head. Not for me. I mean, thank you for all the kind words. And by the way, you can call me Adam. That's fine. I think that is really the key to success in anything. And no matter what your job is, what your vocation is, no matter what you're trying to do in life, I think persistence and understanding that, if you persevere, you can accomplish anything. It may take a lot of work. You may have to wait a while. It may take more than one effort to get something done, but you can get done anything that you really want to. And I was raised that way. My parents are both teachers. And, I grew up with the idea that you can do anything. If you put your nose to the grindstone and do the hard work that it takes, you'll accomplish it. And I've lived my life that way, and it has helped to understand. And listen, nobody has a clear path anywhere. Everyone has bumps and valleys that they have to navigate through and across. And for me, it was the same. I had my trials and tribulations, but I always went through them knowing that, hey, I know what my goal is. I'm not stopping until I get to that goal, whatever it takes. When you hit a roadblock, you turn in a different direction and navigate around it. So I do believe that, and I think you're exactly right. Understanding that you can do anything if you persevere and you put that hard work in, there's no limit. And that I think is what drives this country, the United States, one of the most amazing places in the world. Look what we did with a vaccination in record time. The world was suffering. Our country was dying off in significant numbers. It was very scary. But, with ingenuity and effort, we've got vaccines that are saving thousands and thousands of lives daily, hundreds of thousands of lives. And that all happened in a blink of an eye compared to what it normally takes to develop these things. You can do anything if you just put the right amount of effort in, don't give up, and just keep persevering.
I love it, Adam. Thank you so much. Make sure you hashtag It's Not All the Same. Wonderful videos. Adam, thank you so much for being a beacon of light in your field. I know that it's just a holistic approach to wellness that you provide your clients. And, when some of those dark sort of practitioners start doing things that, they shouldn't be doing, or not taking care of their customers or their patients, I guess, their patients. We need someone to be a leader. We need a beacon of light. We need someone to expose what's going on so that people can make better decisions. And you never really know how far it's going to go just with someone watching one of your videos on social, because maybe it changes their entire course of their life. Maybe they were going to go see someone and they watched your video and they had a second thought and they selected someone that was maybe an American board certified plastic surgeon instead of perhaps who they were going to go to for the drive-in plastic surgery, as you talk about on your show. So thank you so much for doing not only an amazing job with your own practice, but sort of safeguarding, the entire medical community in terms of helping to bring light into an area where, if darkness is starting to creep in, you're the one that lights the match and gets rid of the darkness. And I want to thank you so much for coming on the Entrepreneur Spotlight Series today.
It's been my pleasure. Thank you for having me. And, it's a great opportunity. And I think just in the same way that I'm working hard to try and make people understand these important issues, I can't do that without outlets like you. So I really appreciate the chance to come on and talk with you. I hope that we're both helping a lot of people today.